Morning, Mr. Manager.
Morning, sir.
You all set?
Yeah. We have two issues today. We're going to have a briefing on ICT-1, and let me talk just a second about that. And then the only other item is the legislative agenda update. Mike's going to do some talking on that. With ICT-1, this is the 90-day analysis. We, as you all know, a couple weeks ago went down with the unit. We are bringing the unit back up, and once we get past the Thanksgiving holiday, the first week or so of December, the unit should be back up. Doc, you can correct me if I'm wrong on any of this when you get up there. But the plan is to bring that back up and continue the experimentation period, at least for another 60 days, to do further analysis. And then probably come back again and report. And on both sides of the street, we'll have a policy decision for you of whether to bring down, keep status quo, or enhance this program. So I guess one step at a time, we'll take the 90-day assessment today. I think Dr. Gallagher is going to present it, and we can ask questions and make plans from there. So.
Very good. Morning, Dr. Gallagher.
Good morning. John Gallagher, I'm the Director of EMS. This is the official 90-day report out from the pilot study. The trends are essentially identical to what was presented previously to you guys, but this to check the box and close the loop, this is the final numbers after all the shifts were completed. So a lot of this will look familiar, but the numbers have been updated to reflect the entirety of the program. So as a reminder, the layout of the team is a 3-person team of a qualified mental health worker, a law enforcement officer, and a paramedic. The dynamics on the street are variable, but are traditionally in the roles of the paramedic provides the driving. The qualified mental health provider works with the computer, and then the law enforcement officer monitors the 911 system for incoming calls. The beginning of the shift is typically coordination, determining the work for the day, and choosing the best way to approach what's available within the 911 system at the time, and are also able to supplement times in between calls with the MCU referrals as long as it's daylight hours. They've also been successful in developing an ownership model for psychiatric transfers that need to go on involuntary transports, which has allowed them to be slightly more efficient for those particular call types. They are getting most of their calls through self-dispatch, but are also getting referrals from the crisis center, from the PD case desk, doing scheduled checkups on patients that they've seen before, and then also real-time referrals from both the fire and EMS system. We tracked a huge collection of determinants to try to best understand exactly what the work was being done and what the determinants were, as well as what the outcomes for the patients happened to be. This is just a list of some of the things that were tracked. The outcomes are what we're here to talk about today. They were able to complete 53.5 shifts. That's down 1.5 shifts due to illness. They were able to see 205 patients that averaged out to about 4.1 patients per shift.
How much time is spent per patient?
Oh, I'm sorry?
Like on average, how much time is spent per patient?
About 3 hours. All comers. Some are longer, some are shorter. This is a breakdown of the final distribution of the outcomes. So the red bars represent patients that or situations where there was no patient, no one to encounter. The yellow was handoff to other options like EMS or law enforcement. And the green represent the treat in place, which was the primary target of being able to get these people the resources they need where they happen to be at the time without a transport need. This is that same information with the no contacts removed to give an idea of what the final dispositions are for the times that the team does encounter a patient, and illustrates that about half of the time they're able to treat people in place. So the secondary metric was what we could free up for resources within the traditional 911 system. We were able to free up 141 law enforcement units, 96 fire apparatus, 92 ambulances for a total of 329 total resources. We were also able to avoid 114 ComCare Crisis Center visits and 92 visits to the emergency departments. For law enforcement specifically, 70% of the ICT-1 calls involved a law enforcement officer that was able to be freed up and returned back to the 911 system, which was estimated to be about 226 hours worth of officer time, with a median call time for them being about an hour and 20 minutes. It's a little difficult to figure out exactly how many calls downstream of any additional event might have been prevented. We know from historical experience that oftentimes when we get one of these calls, that person will become 2 or 3 calls in the future. And we just don't have an ability to measure what didn't happen, but we do believe that some of those calls would have been prevented. It's just putting a number on it isn't possible. This is a heat map of where all of the ICT-1 calls happened. Obviously, we expected to see that concentrated in the core of the city, and that was the case. But we were also able to show that they were able to get outside the core and even into the farther reaches of the county. So they were able to generate services further out. So a cost analysis for this, I want to be clear that this is not a cost savings program. This is actually a program that costs money and allows us to reinvest freed up units back into the system. So looking at the value of either per shift or per different time frames of what the value of the resources, the traditional 911 resources, would cost, this would be the value that we were able to return into the system. And then the second to last row was the cost to operate ICT-1 over that same time period. So depending on what time frame you want to look at, you can see what was the cost and what was the value. But again, to be very clear, there were no cost savings in this, simply an expenditure to reinvest those resources back into the 911 system. So where we stand today, we have an update for you from the last time I was here at staff meeting. Was able to close a loop with our law enforcement partners, and we have an agreement from the city police chief to fully staff the law enforcement component. But simultaneously, we are also hearing from the sheriff that he's interested in participating and staffing half of the law enforcement. So we now have more engagement than is necessary to run the program from a law enforcement side. So we'll figure out between the two of them exactly who wants to bring what for resources to the table. The fire department and EMS have agreed to split the FTE for, the city fire department and Sedgwick County EMS have agreed to split the FTE for the paramedic, and ComCare is still all in for a full FTE on the qualified mental health worker. So what we are looking for today is direction from the commission as to how we would like to move forward. Or if we would like to move forward. We have started to lay some groundwork for getting this back up and running under the same model, and we would hope to be able to do so in December. I'm not sure if we'll make the first week. We've had some staffing changes. One of the law enforcement officers was promoted to a new position, so while we congratulate him, he's not available to the program anymore. One of our people is out on medical leave, so getting the inertia back of what we had before will be a little bit of a challenge, but I do think if we stick with the same model, we'll be able to be up and running in December. We've heard some rumblings that there's discussion of going to a different model or investigating other models. If that's something that the commission wishes to do, we can do that instead. So really looking for direction from you guys today as to how you would like us to proceed.
Well, good. I know we're going to have a bunch of questions. You said that we're not going to use Fire District number 1, right? It's going to be paramedics out of the EMS?
Correct.
Okay, that's good. I don't know that our Fire District 1 should really be participating in it.
I agree, although I appreciate their willingness to step up for the initial pilot.
Okay. Are you going to explore different hours or different days? Are those days and hours the most optimum days and hours that for this program to be running?
So based on the 911 data, we believe they are, although I agree that we should look into, is that in fact the case? Should we try a different time frame or a different setup that would allow us to see if there's a more optimal time? If we decide to proceed, I think that's something that should be on the table.
Okay. And when we dispatch outside of the city, and we've got a police officer on, does he have authority outside of the city?
So under normal circumstances, no, but for purposes like this, the agreement between the sheriff and the police department exists so that they can have authority on those individual cases, yes.
Okay, good. Other commissioners?
Yeah, I got a question.
Yes.
Okay, so you say that when you go to your cost analysis over here, you know, it's costing us money. But if we were to put a price tag on where these people would have gone had this team not been in place, what would that cost be? Like these resources freed up, you know, what would that cost saving be? Because, I mean, to me, it looks like we're spending $48,000, but what would we have spent had this team not been in place?
It would.
Like, where would they have gone?
Where would who have gone?
So all the people that were treated in place, would they have gone some other place?
Yes, a lot of them would have gone to the emergency department.
Which would have cost what?
Astronomical.
You see, that's the type of numbers that I would like to show,
Yep.
so that we could show this little wheel right here, how much it would have cost us had this not been in place.
The amount that it would cost us being the county, would be the sum of those value amounts in the columns above. The amount that it would cost the patient or the hospital system or the larger community as a whole, you would have to incorporate those things like the hospital costs. Unfortunately, we don't have any access to that data as to what the hospital costs would be.
You see where I'm getting at, though?
Absolutely. It's a huge potential numbers from a community standpoint. From a county taxpayer dollars standpoint, that's what we have on the slide. But I totally get it.
So as Via Christi or anyone, are they able to identify cost savings? Is there any way of quantifying it through the providers?
Quantifying healthcare costs is an impressive web. I don't know that I would be able to get you really reliable information on that.
But if we had, I'm sorry.
Well, Via Christi's been a very good partner with us in a lot of different things that we do. And if they're seeing a significant decrease in costs, they ought to be willing to say, hey, that you're helping us out somehow.
I would think so, and we could certainly have that conversation with them. We do know that it's having benefits for them. The confidence in the ICT-1 team has risen to such a level that they are even now looking at processes for allowing patients who have been assessed by our team to bypass the emergency department and go directly to psychiatric care. Not only is that the right thing for the person, but it also is efficiencies for the hospital. So you're correct. They've been very good partners. I do think we could get some information out of them. That will be slow and complex.
I believe as part of the Community Crisis Center research that there has been some data. They've tried to extrapolate some data as to cost savings or cost deferral to hospital ERs if patients are diverted to the crisis center. And I think, I don't know how those dollars would exactly fit into this model, but I think there's some potential data already out there that exists from prior studies for the crisis center. And then also if we could determine how many of those treat in place would have, again, it's something that we don't have a crystal ball, but some of those would have been repeat calls that at some point may have ended up in an arrest and a booking of a person with a mental illness or in a substance use crisis. And so you have jail cost deferrals and hospital ER psychiatric ward deferrals where you were able to manage them in place, work with family to have a plan to keep them stabilized until they could get them to another appointment later on or something like that. So there's some metrics there that we need to look into as we move forward with this pilot.
What kind of involvement have you had with the Mental Health Coalition?
They're engaged and they're interested. They don't have the staff to really participate as a boots on the ground type scenario.
No, but I mean, have you been going to the Mental Health Coalition meetings?
Yeah, well, my staff has. I haven't myself, but yes, we're definitely connected with them to have shared path.
So when are we getting briefed on that plan?
I'm sorry, which plan?
The Mental Health Coalition plan?
So in our program closing meeting with all of the stakeholders on this, there does seem to be appetite within those departments to push it forward. The unofficial target would be to get us to the next round of budget cycle, to be able to bring you additional data for assessment, and put some more refined numbers on what it would cost if we wanted to continue it forward as a permanently funded program. We would be able to do so on existing budgets through the end of the calendar year, and then my understanding is there's some earmarked contingency funds that could be considered to support the program for all or some of the 2020 year. That would, of course, be up to you guys.
Okay. Commissioner Meitzner?
Thank you. Doctor, you mentioned that, so I assume you've all been tweaking some things here and there. But my recollection is this is the same model in generality that our Colorado Springs study and Tulsa study.
Correct. The three-person design was their idea.
Right. So in your presentation, you were mentioning there's other plans or something. What did you say? You said, is there other? It's been discussed that there's other models or something. Did you say that?
That if the commission as a whole wants to investigate additional methods for delivering this, that's something that we would consider. That would slow us down, but we could do that as well.
Okay. Is there any basis or history on, quote, other methods that you're aware of, or is?
There are.
I was just aware of this.
No, there's other programs out there. This is a concept that's very challenging for all communities on how to deal with mental health. And we've seen various cities put together different designs as to what they thought would be a way to serve all or some of that population. So this one has been successful for us. The recommendation of the stakeholders is to continue, but we're at your direction for that.
Okay. Well, obviously, unless I saw something that was eye-opening, not only would I like to think, if we kept this going, you got all these intergovernmental agreements. Can they all just be on a revolving 30-day environment unless somebody brings a stop to it so we can work through a budget prices and that way the budget plan, and that way we don't have this lapse like we're experiencing now. I'm not sure the community suffers a whole lot with this lapse, but my thought is that we adjust these agreements to keep it interim unless Tom, you or budget comes to us and says, hey, you're going to have to take a vote to either extend it or cancel or something like that.
I think currently the intent is of the departments that are involved, both on city and county side, is to get this thing spun back up. The original MOU was for 90 days.
Right.
Everybody's in agreement that they will continue with this as soon as we can get everybody scheduled in a room and get it started back up. And during the course of that, we will update that MOU, and the attorneys can insert language that allows this to continue unless somebody comes forward requesting, in writing or otherwise within 30 days. So we can modify the language to allow this to continue until such time as a partner pulls out.
So you were in that mode of continuous agreements. So
Yeah, that's something
you're not
we can
just saying
certainly-
it because I just said it.
Unless the county councilor sees otherwise, that was kind of the intent was
Okay.
to.
I think all the partners.
I agree.
Yeah.
Okay.
The partners are willing to continue without the 90-day being completely updated at this moment, updated as they continue to work.
And I don't
then
know
the
if 30
language will be
days
up
is
to
the
the
right
county councilor
number.
and the city attorney.
Okay. And I don't know if it's 30 or 60 day or whatever. I don't know what the right number is, but whatever's comfortable, I would be supportive of something like that while we figure it out, the permanent funding. I don't have any other questions at this time, but thanks.
Okay.
for the
Other
presentation.
commissioners? Commissioner Howell.
Thank you, Mr. Chairman. Apologize for my throat. I got a real frog in there. I'm trying to get rid of it. But looking at your numbers, just a couple questions. You said there was 205 patients. That's in all categories, correct?
Correct.
Looking at your bar chart, I just kind of tried to read the bar chart since I don't have the exact numbers per column, but based on the bar chart, it looks to me like if there's 205, that may be hard to pick off the chart there, but if I break it down, it looks to me like there's about 75 or so that were treated in place. And yet you say there's about 51% treated in place. So I'd like to see the exact numbers per column brought to us because I'm having trouble interpreting this. If it's 75 or if it's 103, I'm not sure what the exact number treated in place would be, but I guess I, for one, would like to see a few more pieces of data. For example, can you talk about how many times EMS provided some type of medication at the scene that the paramedic used his paramedic skills and his certifications that were necessary to provide some type of medicine there, on the scene?
Sure. So there's two questions there. There's one is when did the paramedic use their skills and certifications, and the second is how often did they give medicines. I believe they gave medicines on 3 occurrences. I would assert that they used their paramedic skills and certifications on essentially all of them. One of the hardest parts of this program is determining who's in medical crisis and who's in psychiatric crisis. So independent from medicine administration, the paramedic is a vital role.
And those 3 times, did they also transport them?
I'm not certain what the dispositions were. I would expect yes, but I'd have to check them to be certain.
When the team showed up, did they ever need to call a backup LEO to participate in the at the scene as well?
So in some of the cases, yes, they're pre-identified as requiring 2 law enforcement officers. So the LEO on the team would count as 1, and they would need an additional from the responding jurisdiction. So in cases like that, they would only be able to free up half as many law enforcement officers as typical. On a call where they don't need that, they'd be able to free up both law enforcement officers.
Do you have that data somewhere that we can know how many times that happened as well?
We could probably find the call types that would be normally assigned to having 2 officers. That would be a fairly close approximation.
Just if my colleagues haven't seen it, I think there's a lot of places in the nation that uses this other model. I know Oregon is pretty popular. It's a model called Cahoots. They've been doing this for about 30 years now. But they have 2 people make up the team, not 3. It's a law enforcement officer and a mental health professional. And they're both plain clothes, jeans, T-shirts. If the officer's carrying, he's carrying in a concealed fashion, so it's not threatening. They come in a plain vehicle, not a red vehicle, but a plain vehicle. And if they need law enforcement support, or if they need EMS support, they call them in, but they don't have them as part of the team. Just to throw that out there as something for us to look at. I would like to see us, if we're going to continue this, I'd like to, again, doing the exact same thing we've been doing for 90 days and do it for another 90 days, in my opinion, is not necessarily is not helpful. I would rather see more data, a different type of data available for us to analyze. So if it's different times of the week, different way we show up on the scene. One thing I would say is I don't like the idea we're pulling from WPD and from the sheriff's office. They've hired the officers they need for their team. And if we're going to continue this, I would rather hire a law enforcement officer and hire a ComCare person so they become a team that's the same people every day. One of the things I asked you earlier was how many people constitute this team, and you said about 10 people. And so every single day they come together. The reason they're spending 60 to 90 minutes probably is because maybe they haven't worked together as a team before that moment. And so every time you bring a new team together with different personalities, I think they've got to have some time talking that through. If they're the same people every day, my guess is they'll hit the ground running. That might increase efficiency a little bit. But the fact is, I would rather hire somebody for this pilot, and if it doesn't work out, we'll absorb them. I'm sure the sheriff could use another officer, or ComCare can use another person, and we can absorb them. And we don't need to let them go. So I would rather see someone come together as a dedicated team rather than this ad hoc team that comes together each day. To me, that would be trying to be the most effective. That would be a better way to do the next 90 days, in my opinion. I'd like to try something that's not a red vehicle, only because I think that it doesn't necessarily disarm people. When they see a vehicle with ICT-1 on the side, I think it actually maybe causes, it would me, if I was, needing something to talk to somebody and you show up in that vehicle, it would add stress to my life. It wouldn't disarm me. It would actually make me more nervous and more elevated, perhaps, in my emotions. And so I just like to change this up a little bit. I wouldn't mind different days and hours. One more thing is, if we are going to hire people for this, I think I would like to talk to Wichita if they're dedicated to the idea. Honestly, the county actually has county-wide jurisdiction. I would rather this be a sheriff's officer and a ComCare person come together in a county vehicle, countywide, and whatever the cost of that is, I'd like to ask Wichita to pay for half the cost. And to me, that's less complicated than having a 4 or 5 or 6 headed jurisdictional monster that it's hard to know who's doing what, and it's hard to know how these people are being paid. To me, it's if we have a dedicated team under the sheriff's umbrella, they can go anywhere in the county. And so just to be clear, I'm very much in favor of mobile mental health services. I'm not sure I'm happy with the 90-day pilot. The reality is we're spending 30 man hours per day, and by my looking at your chart, and I don't understand why my numbers don't match your numbers, but it's either 75 or 102 people were treated in place, and that's 30 man hours per shift. And so in terms of our efficiency, we're not as efficient as I think we could be. And I think the reality is the cost of this program is in competition with a regional mental health facility. And so whatever the cost of this is, I'd like to know what it really costs, because if we're going to absorb these costs, and it's not going to be state or federal funded, if this is at the end of the day, if you're going to try to do more than just one mobile mental health team, if you're going to try to do this around the clock, or you're going to try to have more than one, and maybe you need to have maybe some extra people because you have vacation, sick leave, have to be thought through. The reality is the total cost of this program, once it's full up, my opinion is probably going to be several $1 million. And I think if you have several $1 million on the table, you might as well start talking about a mobile mental health facility.
Several $1 million?
Yeah, of course, because right now we're talking
We'll
about,
take it.
Let me explain this.
Okay.
Let me explain. Right now we're doing less than 25% of the week. It's 168 hours in a week. We're
They're
doing
going
40
at
hours.
they're going at the critical hours of need based on data.
I hear you.
They're not. We don't. Why would we do it 24/7 if we don't need it?
It's open for
24/7?
discussion whether we should do it other parts of the week. That's something we need.
Well,
to
I'm
need
not.
to find out.
I'm not for millions of dollars, and I'm not.
And the
for
reality
something.
is, we're talking about we have one team countywide. If we have 500,000 people, I'm not sure that one team actually is going to make a significant difference in our data. And so the reality is, if this is a good idea, I would like to see mobile mental health truly funded, and not just have a single team that's able to go. Mobile mental health, in my opinion, is a big enough issue. One team, in my opinion, is not really the answer. And if you're going to try to have a number of teams that can do this and do it in different times of the week, it's going to get expensive. And the reality is that cost is in conflict, or I should say in competition, with a mental health facility. So I'd like to just keep that on the table. Our problem statement is mental health. Our solution has a lot of parts to it. At the end of the day, we're treating about one per day in place. And I'm just going to say it's a fairly expensive investment for one per day. I think that the same money ought to be considered. What are we going to do differently to make this better, make the numbers improve? And right now, just doing 90 more days of the same thing, in my opinion, is not useful. If we change this up, maybe follow the Cahoots model, for example, or pick different times of the week, then I think there's value in extending the pilot.
Sure. Well, thank you. There's a lot to unpack there. Just one correction I want to make. The Cahoots model is a paramedic and a mental health worker. They don't deploy with law enforcement. So if they find themselves in those situations, they would have to call for law enforcement. So, but it is a very well-established program, yes.
I would agree that was a lot to unpack. I think that, it took us a lot to kind of get to this place. When we think about how many, the life that was saved before this program was even in place, I think that there is a lot to be said for just the work that's been done thus far. And trying to, I don't disagree that there are always improvements that can be made. I think that building upon what we already have, in my opinion, is probably the best use of the dollars that we're spending, just quite frankly, because it seems like it takes a lot to get things going. And, I appreciate the work that's been done thus far, and I am looking forward to this. I would love to see how we could translate this into, dollars saved. I get it, that's going to be hard to do, but if we have an opportunity to convince our hospital system that maybe they should chip in because of all the money that they're saving, maybe that's another funding stream that we could, Tom, you could go ask for. I just think that there are other ways that maybe we should be spending our time. And if it's, figuring out data that might convince others to get involved, that's where I would like to see the time spent.
Thank you.
Very good, Dr. Gallagher. We appreciate your time on updating us today. So you're going to be spun up what day?
We don't have a day yet, so we got to get the team back together. We lost a lot of inertia.
Very good.
It'll be as soon as possible.
Bring us back up to that date when you know when, all we need is when you're going to go back active again.
Very good. Thank you all.
Thank you.
And just to clarify, once we spin it up, it stays spun until one side or the other unspins it. We'll keep going until either the commission or the council says, one of the partners says, no mas. Okay. Michael, work that MOU up. Great. Speaking of Mike, you want that?
All right, Mr. Papoon.
Got some handouts coming out here. I need one as well.
Thank you.
Yeah.
Yeah, mine.
Okay, some of the handouts you have in front of you, we are continuing to work our way through adopting a platform, and we might talk first on the 2020 Sedgwick County platform document that you have, and I'll explain the other documents support that one. Some of the tweaks I've made after talking with some of you individually this week. Under the behavioral health, one of the first page really hasn't changed. One commissioner mentioned that behavioral health may encompass more than, or not be as specific as we might want to be. And so I put in parens mental health, substance abuse. I think the chairman also mentioned homelessness, which could be discussed. That may be a subset of mental health issue. But we may want to, do we want to use the term behavioral health in this broad a sense as we've been using it the past year to address these problems? So that's one of the changes. Then to the second page, I think still a priority issue for the county ought to be nuisance abatement. And I think Justin is here and may want to comment on that if you want. He has a handout that's part of that called Nuisance Abatement 2020 Sedgwick County Legislative Platform. Talks about what a nuisance abatement bill would look like. Of course, we had one last year. This is modeled pretty much after that, but it's a bill that would allow people to have their due process, and we would only use it sparingly. But I know each of you, or at least almost all of you, have properties in your districts that have become problematic and might need this legislation. The privacy consideration one was really an amendment to the Kansas Open Records Act, which would allow detention deputies and former law enforcement officers to maintain the privacy of their home addresses. This probably won't become much of an issue unless the legislature wants to open up the Kansas Open Records Act. Sometimes the legislature doesn't want to mess with that. But if it does, I think this would be a fairly easy amendment to add to it. The Charter Commission, as I've mentioned before, when we got our urban status legislation completed, we got everything Johnson County did except the Charter Commission, and they didn't make Charter Commission, they didn't have a statute dealing with a Sedgwick County specific Charter Commission. You have another document that I have in front of you, KSA 192682. The front page is the Charter Commission that they use in Wyandotte County, or Johnson County, excuse me. There's some Wyandotte County aspects to it, actually. And then we have two proposed drafts. Michael Fessinger in our office came up with a proposed 17-member Sedgwick County Charter Commission, and I worked up a 15-member board on the next page. And again, I think these documents you just need to take a look at. It's a little premature. We'd probably want a bill ready to go and a legislative sponsor at the beginning of the session, but need to get input from the five of you on what you think a charter commission would look like for Sedgwick County.
Mike,
Yes, sir.
tell me, re-explain to me what's the charter commission? What's the benefit for our county to do a charter commission?
The benefit for the county for the charter commission is it allows another legislative avenue for consolidation and reorganization. There are statutes already that provide for these things. It could be expansion of the commission. It could be combination of elected offices. It has a lot of broad implications, and that's what it'd be for.
Okay, thank you.
Additional issues that I mentioned that we need to discuss. Commissioner Howell, number one, I've taken the email I received from the District Attorney Mark Bennett and changed that issue to amending our Kansas motor vehicle laws to allow citizens who have paid their fines or child support to get their driver's license reinstated. He's part of a task force now that's looking at that issue as to whether or not the license should be continued to be suspended for like 6 months. The number two issue was I've changed this to support efforts by the Kansas Attorney General's Office to adequately fund the scrap metal database. Unless law enforcement and the Attorney General wants this funded and wants to make this an issue, I don't think this should be a lead issue on our part, but we can certainly support them. The third additional issue is we've softened this on expanded gaming to say that if the state supports legislation expanding gaming for Sedgwick County and South Central Kansas, that a portion of that revenue should be distributed to Sedgwick County to address the behavioral health needs in our region. And we could put mental health or substance abuse if we prefer that wording. And the last one is the chairman brought up at the meeting last Tuesday an article that he had seen in the Kansas County or the National Counties magazine that dealt with Oregon using a pilot program to allow service members overseas to use an app for voting. Justin Wagner actually called one of the counties in Oregon yesterday, and it appears that this is a pilot program that's very early in its infancy, and there are probably some other federal acts, UOCABA, which I don't have the exact wording or the wording of what that acronym stands for, but it's a national act dealing with making sure that servicemen can vote. And then there's another federal act too that was adopted after UOCABA that addresses this issue as well. We may be a little premature for that fourth issue. And then the last part of the platform I have is the joint partner statement that we like to have in our platform to show that we're working with our other partners in the community, the Wichita Regional Chamber of Commerce and the City of Wichita. And the City of Wichita, I believe, today in a workshop is actually addressing their platform for the first time. So we should have a better idea after today where they might be heading with their platform. But this can be a document you can review and give me feedback later, or we can make some comments right now.
Well, I think on additional items, item one, we can let the task force work that, and then we can put our voice to that task force and let them know that we support it. I don't know that we need to have that on our legislative agenda right now, but if we lend support to the task force, that'd probably be sufficient. The second one, if law enforcement and the Attorney General are working those, again, I think we could lend our voice to those issues and say, hey, if you need support, well, we're here to give you support. And I think on item 4, I agree it's too soon. We need to make sure that we get that accurate. So, and right now I only see one additional issue that we need to talk about.
Number 3?
I would agree with what you mentioned about 1, 2, and 4 at this point.
Sounds good.
I have a couple of things I'd like to discuss.
Certainly.
Yesterday, Commissioner Meitzner and I met with our chief judge, and he mentioned, he was going to petition the state for a couple of new judges, and we had talked to him about, what those judges would be used for, and if he would consider a mental health court or a veterans court. And he mentioned, we just don't have the space, nor do we have the judges for the ability to fulfill a program like that. And so, I just asked him if he would, if we could consider supporting something like that, or how that works, because I believe that fits into our broader mental health plan. If we know that our drug court works. If we had another specialty court that could be implemented, that we could then utilize that to rehabilitate folks. So I'm asking for us to consider that. I'm also asking for us to consider Senator Letha Fauskido. She emailed me about a domestic violence bill in the Senate. She said that it was passed in 2012, but it hasn't fully been implemented. So I'd like to send that out to commissioners to consider, because there are some changes within that language that require domestic violence offenders to receive different types of help as far as getting that under control. So I'll be sending that out to everybody. I know it's kind of last minute, but I would like to consider that. I know that this is getting a lot, but if there is momentum in the Senate to get that sort of passed, I think that it absolutely fits into our public safety plan. I mean, on December 11th, we're having some funding requests come up for the Wichita Family Crisis Center. So this does fit into our wheelhouse, and if it's something that could be accomplished, I think it would be a win for us to get that legislation passed and be supportive of it.
On the mental health and veterans courts, I'm not saying I'm opposed one way or the other right now, but if they're saying that there's no space for them, how would we support that?
I think that fits. If that fits into our grander scheme and our discussion of what we're going to do with our building. If we have our chief judge telling us that we need more judges to handle the caseload, maybe that will put something, a fire under us to determine what we're going to do with the future of our building, that kind of thing. So I think, something's got to light a fire, and I don't know what would do it if that's not it.
And yes, I was in the meeting, and I heard what Judge was talking about. It kind of made sense. What I didn't think about until later, or was noodling around, is the impact we need to look at all the impact with the jail, the sheriff, and Bennett's office on the prosecution side and public defender side. And so there's a few other components that might, but the space was easy. It was a more finite discussion. But we probably ought to look at, or ask Tom or these people to run it by Sheriff and Mark Bennett to see if that's something that...
It is true. If it's a simple math of adding 2 courtrooms, there's going to have to be a budget allotment for the sheriff and the DA that have to keep up with the load. It does us no good to have judges without the support staff. So.
I think one of the issues that we might look at there, and we'll certainly look at both of those issues, Commissioner, I think one of the things we'd want to consider is, can we do the mental health court, veterans court right now? Are we supporting the judges? We could send a letter in support of a couple of more positions if that's what Judge Gehring is wanting. But do we really need legislation to create those 2 courts? If we don't need legislation, then it probably isn't going to go very far on our platform. If we do need legislation, then that's something we would want to certainly look at. And we could certainly come up with a platform position pretty easily, supporting, in essence, the bill that Senator Godot was looking at, just a general statement supporting legislation that would address domestic violence in our community, something like that, which we'd be able to do.
Anything else from any commissioners? Hey, Mike.
Thank you.
Thank you.
Okay,
Appreciate it.
thank you.
All right, what else you have, Mr. Manager?
That's all, sir. That we have reached out.
Very good. Commissioners, anything this morning? I thought I'd better bring the rest of the commissioners up to speed. Last week, if you remember, why the sheriff came in and briefed us on this Odyssey software in full court. And so later on, I asked the sheriff what Supreme Court justice is working this, and he said Justice Biles. So I happen to know Justice Biles, so I gave him a call and said, hey, can we talk about this? So tomorrow morning, Rusty and the manager and Glenda, the DA and the sheriff, were going to have a conference call with Justice Biles and with his IT folks to see if we can work something out. We did send a letter from Sedgwick County Commissioners supporting access to Odyssey for all the folks that need it, but we need to make sure that we do have the access. From what I could find, and I am not an expert on this, I rely on the experts to tell me, but to boil it down, it appeared to me that the true problem is access to Odyssey. And so that's what we need to make sure that we have, is that the people in Sedgwick County that need access to Odyssey have access to it. So we're going to see if tomorrow morning at 8:30 that we can get something done with the conference call. Justice Biles said he would be on the conference call with us because he's the one that's in charge of it. So I think we're moving anyway. I don't know what the solution's going to be, but at least I wanted to bring everybody up to speed since the sheriff briefed you all on it last week. Anything else?
Good. Making progress, hopefully.
I don't know if it's progress yet, but at least we're talking.
I thought it was progress.
That's progress.
Before we weren't even talking.
That's right. Okay. Anything else from commissioners? Anything from staff? I don't see any electeds, so. All right, we'll go work. Thank you all.